today's video, we're going to talk about 4 steps that you can use when you have found yourself falling off your treatment plan recommended by your doctor, your therapist, your physical therapist, while recovering from pelvic pain, low arousal, and all sorts of those issues that are impacted. I'm Kayna Cassard, and I've been helping vulva owners and couples recover from the impact of pelvic pain, low arousal, and intimacy issues since 2006. So if you find this information to be helpful, make sure you subscribe and hit the notification bell so you don't miss a video that might actually be the linchpin in changing your sexual life so that you can actually feel more fulfilled and satisfied in your intimate life. So we've all been there. If you've been in any sort of pelvic pain treatment, it is so easy to fall off the wagon of the treatment plan and recommendations set forth by your doctor, your physical therapist, your couples therapist. You're having to do a lot of things. Put on your creams, do your PT exercises, meditate, do some breathing exercises. How about some intimacy exercises? All of those things can be recommended when you're in pelvic pain treatment. And I have been guilty of falling off that wagon many times. And if I had known this information I'm going to share with you in today's video, I would have been done with my treatment so much sooner. And so we're going to talk about the 4 different ways that you can help yourself get back onto your treatment path and not beat yourself up over it. So those 4 ways are going to be, you can either do them all at once, you can do them in conjunction, you can just do pieces of them. They're just 4 steps that are going to be really impactful. And I know because these are the ones that I use, and this is what I use with my clients. So the first one is to make a backup plan. Now, a backup plan is creating a list of things that are like small options or things that you can do in a short period of time that at least it gives you some win, like just a little win, so that you're not losing momentum in your treatment. So this might be something like putting your dilator just on the opening of your vulva for a minute instead of doing your full 10 to 15 minutes of the dilator exercise. So even just doing a little bit of that can really go a long way. And the reason why that, for instance, is a great option is because the idea of using dilators, for instance, is just that we want to get the brain retrained on thinking about something at the vulvar opening or the vaginal opening. We want to get it retrained to believe that something at that area is not painful. And so if you just spend 1 minute really breathing into and experiencing what it's like to have the dilator just there, resting there, even if it's for a minute, it still continues to build this new neural pathway that something around the vagina or in the vagina is not painful. So even if you can't do your whole full-on PT exercise, this is one great way. So doing something along the lines where you make these small little efforts, like maybe putting your creams on at night if you forgot in the morning, being okay with just getting them done in the evening, or maybe you reduce down how many times that you do your creams from twice a day to just like once a day. And maybe that will be enough to be able to get you motivated and get that momentum going. So there are a lot of ways that you can do this and making up a backup plan with just a list of little wins that you know that you can achieve in order to just keep that momentum going. So the second thing that you can do is create sticky notes. So I put sticky notes like literally everywhere. I mean, if you looked at my desk, you would see that there's like right now about 10. And it kind of drives me wild, but it motivates me to get them done and to take them off. So when I see them around the house, if there's something I absolutely have to do and I just cannot remember to do it, I put the sticky notes there because it bugs me so much to see it there on the wall, and I want to make it go away. So I'll remember, oh, okay, look at the sticky note is there. I see, do the meditation. And I'll do it enough times to where it starts to become habit, and then I can have that satisfying experience of taking it off and throwing it away. So if you have to do this for a while, maybe change it up every few days. So you might have, a sticky note here for 2 or 3 days, and then you're going to move it over here. because it'll change up in your brain. It'll be a novel experience. And then you get the satisfying feeling of taking it off. So that is the second way that you can do that. And you can do that with any of your PT recommendations. Put the sticky notes on your mirror, put it on the refrigerator, put it on your phone. There are so many places you can put it. Just anywhere you're going to see it, anywhere it's going to stand out to you. So the third way that will help you get back onto your treatment plan is to actually do some grounding techniques or some nervous system regulation techniques whenever you can think of it, at least 1 to 3 times a day, and just like short little ones. Could be a minute long, it could be 10 breaths, just noticing on the exhale what it feels like to have your clothes move on your body as you exhale or as you inhale and exhale. Just doing any of those grounding techniques throughout the day can really help you get regulated, help your nervous system get a little bit more calmed and relaxed. And what that does is that it helps us with making better choices for our health. So if you're feeling a little bit more regulated, you're going to not want to just sit and scroll on your phone as often as you would if you're like grounded and regulated and realizing, okay, I actually feel like pretty regulated to not just go on and try and zone out and like get some brain mush happening. Instead, you're going to feel comfortable doing the things that you know you need to do in order to make your health improve. So then the fourth way is dealing with guilt in healthy ways. Now, what this is that it's not about removing guilt, because we can't remove natural responses to things that feel bad for us. And sometimes guilt can be healthy in the sense that it gets us motivated to do the things we know we need to do. But what we don't want to do is beat ourselves up about it. So the process that you can have when you notice that guilt is coming up, or that you're feeling really bad about not doing your dilators, about not doing your creams, about not doing the intimacy exercises, is just one, have an understanding that it happens. So just awareness, simply having an awareness. Oh, I didn't do my dilators today. Okay, that's fine. It's okay. I'm not gonna beat myself up over it. So the second thing is to have compassion. And then you can take actions in little ways like what we've talked about today. So you might even speak to yourself in a really loving way, the same way you would speak to a friend of yours. You wouldn't sit there and tear down your friend for not doing the thing that they know that they need to do. They already feel bad about not doing it. You want to speak to yourself that way. So you might say something like, oh shoot, I didn't do my dilator exercise today. That's okay, it was really busy and I just kind of forgot. But you know what? I remember I listened to a video that Kayna suggested I put a sticky note. So you know what I'm gonna do is I'm gonna write down on my sticky note and I'm gonna put it right here where I see it every day. And then tomorrow is a new day, and so I will take steps to try that out tomorrow. And maybe instead of doing 10 to 15 minutes, maybe I'll put my dilator just for a minute, and that's all I need to do. So having lots of compassion, judgment-free around being a normal human. Now, the important thing about what happens when we fall off the treatment wagon is to have the understanding that this happens for a reason. Dealing with pelvic pain treatment is not just a set of actions that are so easy to do because there's no emotion around it. The reason that it's such a challenge to do these things is because it's a constant reminder of having to deal with something that is really emotionally and physically painful. So of course your body is going to want to be like, oh, let's just forget about that thing because I am really scared about doing that thing, or I feel really bad that I have to do this even. And so there's a lot of reasons, like a protective mechanism, to forget to do these things or to just not want to do these things. So that's why it's really important to have that sense of compassion for yourself. So I really hope this was helpful for you. These 4 ways to be able to work back into a solid, consistent treatment plan. As always, make sure that you consult with your doctor about this. Even though these are expert recommendations from me, a therapist, you got to make sure that it is right and appropriate for you. And if this was helpful, make sure that you subscribe and hit the notification bar button, because then you might be getting more and more information that helps you with your treatment plan to stick to it, to stick to having a more connected, more satisfying, and pain-free intimate life. I'll see you around soon.